For anyone who keeps or works with reptiles, there's this one emergency that is just, well, it's terrifying. We're talking about egg binding, or what vets call dystocia. It's this incredibly complex situation where a female just can't lay her eggs, and believe me, it can turn life-threatening in a heartbeat. So let's really get into it and figure out what's going on inside these amazing animals when this happens.
So, what really goes down when a reptile can't lay its eggs? You might think it's just, a simple blockage, but it's so much more than that. We're about to see that it's this whole domino effect of system failures. We're talking hormones going haywire, metabolism crashing, and even vital organs getting dragged into the mess. All right, so here's our game plan. We're going to start by defining this whole egg binding emergency. Then we'll look at why the system gets so out of whack. After that, we'll uncover a surprise player, the liver, and its critical connection. Then we'll check out the vet's toolkit for diagnosing this, and finally, we'll look at the different paths to recovery.
Okay, first things first, let's get a really clear handle on what we're actually talking about here. So, dystocia. That's the official term. Basically, it means the biological clock for laying eggs has run out. The eggs are stuck inside, and this beautiful, natural process suddenly flips into a super dangerous internal crisis. And yeah, it can become a full-blown emergency fast.
Now, this is where it gets really interesting. Dystocia isn't just one thing. Nope, it actually splits into two main types. On one side, you've got pre-ovulatory follicular stasis. We'll just call it POFS. The best way to think about this is like a traffic jam before the eggs even hit the highway. The follicles, which are like the little egg precursors, they get all mature and ready to go, but they never get the green light to actually ovulate. Then, on the other side, you have post-ovulatory dystocia, or POD. In this case, the eggs did ovulate, they're fully shelled, but now they're stuck in the traffic jam, trapped in the oviducts. And let me tell you, knowing which one you're dealing with is absolutely critical for figuring out how to fix it. So that begs the big question, right? How does this incredibly fine-tuned system get so out of sync? What are the root causes? Well, it's rarely just one thing. It's more like a perfect storm of problems, both inside and outside the animal. Internally, you've got hormones just going completely haywire. Key signals like estrogen or arginine vasotosin, that's a super important hormone for contractions. They're just not firing correctly. But the external stuff is a massive factor too. If her environment isn't perfect, we're talking temperature, humidity, a safe nesting spot, she might just decide, nope, not laying here. Then you pile on things like not enough calcium, which is basically the fuel for muscle contractions, or some kind of physical blockage or infection. And yeah, you've got a recipe for disaster. And you can really see this play out differently depending on the species. Take a bearded dragon, for instance. They're often classic cases of post-ovulatory dystocia, usually because they have these huge clutches of eggs and not enough calcium to push them all out. But then you look at a veiled chameleon, they're kind of the poster child for the other kind, that pre-ovulatory stasis, often just because their bodies are so drained from constantly cycling. Now, when it comes to tortoises and turtles, chelonians, anatomy is destiny. It's a whole different ballgame. A Greek tortoise, for example, can run into trouble simply because its pelvis is rigid, and an egg that's just a little too big can't get through. It's a mechanical problem. And for a turtle like a red-eared slider, things like bad water quality or not enough UVB light can lead to egg impaction. So the big takeaway here is that you really have to know the specific biology of the animal to understand its risks. All right, now we're going to talk about a piece of this puzzle that is so often overlooked, but it's absolutely at the heart of why this condition gets so bad. We need to talk about the liver. So in a normal, healthy cycle, things work like this. The hormone estrogen gives the liver a signal, and the liver gets to work producing something called vitellogenin. Think of vitellogenin as the raw material for egg yolk. It's super rich in protein. The liver is basically the engine room for the whole egg-making factory. But when you have follicular stasis, that traffic jam we talked about, this whole system just short-circuits. Here's how it goes wrong. Step 1. The estrogen levels stay sky high, constantly screaming at the liver to make more yolk. Step 2. The liver goes into overdrive, gets completely overwhelmed, and starts to accumulate fat. This is a serious condition called hepatic lipidosis, or fatty liver disease. Step 3. Now you've got this fatty, sick liver that can't do its job properly, which includes clearing hormones out of the body. And that brings us to step 4. Because the liver isn't clearing them, the estrogen levels stay high, which just screams at the liver even more. It's this vicious, devastating cycle that just spirals downwards. And get this, vets now have a really cool way to spot this liver damage. It's a specific biomarker in the blood. For bearded dragons, if their plasma beta HbA level drops below 272, that's a huge red flag. It's a strong sign that the liver is in serious trouble, suffering from moderate to severe fatty liver disease. It basically tells us that the liver's whole metabolic engine is sputtering out. The body isn't burning fat for fuel like it should be, and this number is the blaring alarm bell.
Okay, so things are clearly a mess on the inside. So how in the world do vets figure out exactly what's going on? Let's take a look at their diagnostic toolkit.
First up is imaging. You gotta see what's happening. X-rays, or radiographs, are the classic go-to. They're perfect for seeing shelled eggs and spotting any obvious physical obstructions. But what about that pre-ovulatory stasis, where there aren't any shells yet? That's where ultrasound is king. It lets the vet see the soft tissues, the actual follicles on the ovary. And for turtles and tortoises whose shells can get in the way of everything, a CT scan is the ultimate tool. It gives this amazing 3D picture of the entire situation.
So imaging tells you what is there, but a blood test tells you how bad things are. Blood work is absolutely essential for getting the bigger picture. It'll show if calcium levels are dangerously low, which would stop muscles from contracting properly. It can pick up signs of inflammation or infection. And of course, it's how we find those critical markers of liver stress that we were just talking about. All right, so the vet has a diagnosis. Now for the most important part. What do we do about it? Let's talk about the pathways to recovery. Treatment almost always starts with supportive care. We've got to fix the basics first before even thinking about drugs. That means getting the temperature just right, providing an absolutely perfect, safe nesting area to encourage her to lay, pushing fluids to rehydrate her, and giving extra calcium to get those muscles working. And honestly, sometimes just getting all that right is enough to solve the problem. Now, if that supportive care just isn't cutting it, the next step might be hormones. Vets can use drugs like oxytocin, which is the same stuff used in mammals, to kickstart contractions. But, and this is a really, really big but, you can only use it in post-ovulatory cases, where you know for a fact there's no physical blockage. If you use it when an egg is physically stuck, well, you risk a catastrophic rupture of the oviduct, so you have to be absolutely sure. And when all of that fails, when medical options are exhausted, the conversation has to turn to surgery. The source material puts it perfectly, and I'm quoting here, "Surgical intervention is considered for cases refractory to medical treatment, with attention paid to timing, anesthetic risk, and postoperative care. It's a serious step." And that really brings us to the toughest question for both the vet and the owner in these situations. When do you make the call? When is surgery the right move? Thankfully, the decision isn't just a guess. It's based on some pretty clear thresholds. For one, if you've tried medical therapy for 24, maybe 48 hours, and there's just no improvement, it's time. If the animal is clearly getting worse, more lethargic, not eating, you have to act. If an X-ray or ultrasound shows a clear, undeniable mechanical blockage, you gotta go in. And of course, if there's any sign of a ruptured egg or a bad infection, it's an immediate emergency. Finally, for those really stubborn chronic cases of follicular stasis, sometimes surgery is the only way to break the cycle for good. So after all this, what's the big picture? What have we learned? Well, it's clear that dystocia is so much more than just stuck eggs. It's a full-blown systemic disease. It's all tangled up with husbandry, with nutrition, and the animal's entire internal world. It's a powerful reminder that taking care of these animals isn't just about making their enclosure look nice. It's about creating an environment that is biochemically and behaviorally perfect so that these incredibly complex natural processes can happen the way they're supposed to. I think the real takeaway here is something we hear all the time, but it's never been more true. Prevention, through really excellent, dedicated care, is absolutely the best medicine there is.